Welcome to Logical Ayurveda. Today we are going to discuss about a very important and a very interesting case of chronic varicose ulcer. So this is the history of the patient who came to me with a varicose ulcer. A male patient who is 45 years old, who is non-diabetic and not having hypertension, having the varicose vein chronic ulcer since 4 years, who came to me for my treatment. His symptom was non-healing chronic varicose ulcer that was associated with severe pain and water discharge on and off from the wound, and it was not at all healing despite 4 years of therapies from different multi-speciality hospitals all over India. He was, since 4 years, he was not getting a bit of relief from this wound. He was referred by, the important thing in this case was, he was referred by another patient of varicose ulcer who got treated under me and who found permanent relief. That patient explained to him that if there is anyone who can cure this varicose ulcer, definitely it is this doctor, go to him. So the patient, before coming to me, had an ultimate severe 100% trust in me, and he was ready to do whatever I tell, and that is the most important part that has worked in this treatment. Now let us dive deep into what is varicose ulcer or varicose vein. A varicose vein, we correlate in Ayurveda to Raktagata Vata or Dhamanigata Vata Rakta, or it is primarily due to inability of incompetent venous valves to push the venous blood to the upper part of the body, that is inferior vena cava, to the heart against the gravity. Now, wound tissues ultimately lack oxygen, thereby healing becomes impossible, thereby resulting in chronic varicose ulcer. I explain to my patient in a very simple terms. I tell there are 10 lifts or 10 elevators which brings the blood from your legs to the heart. Out of 10 elevators, let us say 3 or 4 are irreversibly damaged. The damage is irreversible. It's not going to come back no matter what you do. Varicose vein ulcer ablation surgery, whatever. It's not going to come back. It is irreversibly damaged. My job is not to cure the 3 incompetent valves that is irreversibly damaged, or the 3 elevators which are irreversibly damaged. My job is to take care of the 7 lifts that is still taking overload, that is still not damaged. My job is only to reinforce or to strengthen or to stabilize those 7 lifts or elevators or incompetent varicose veins to take up the rest of the load to the heart. That is the main treatment. That is what Ayurveda treatment is all about. That is how we establish a homeostasis. That is how we are able to successfully treat and cure chronic so-called non-healing ulcers. We are able to easily cure it. So what is the main line of treatment that I gave to the patient? The main line of treatment is Rakta Prasarana, Pitta Kapahara, Shofahara, Vata Rakta line of treatment. Now, what are the drugs that I gave to the patient? In a simple terms, these patients are make the blood very, very easy flowing, strengthen the veins, give Balya Dravyas to the patient, and help reduce inflammation, helps reduce the Shofa. So what is the medicines that I chose? Manjishtadi Kashayam tablet, Kaishra Gugulu, Chandraprabha, and Purnavasavam. This is the tablet I almost choose in almost 70 to 80% of patients. Almost when dosha is different, I also make sure I choose different medicines, but this is the tablet I happen to use in most of my patients. Along with this, the patient was also co-prescribed of this homeopathy medicine, which is R42, Recalvic R42 varicose vein drops, which is equally effective in treating varicose vein ulcer. So this was the result after giving the treatment for just about 30 days. Usually this kind of ulcer, this kind of treatment within this period of time is almost impossible. This is a miracle to me, and that is why I am sharing this with you. Usually varicose vein ulcers take about 3 to 6 months of time getting healed properly, and to come up properly, to heal it completely, to do the proper cure. It always takes time, but in this case the patient was miraculously cured within 1 month of the medicine. See, 100 patients, if 100 patients of varicose vein are seeking treatment from different part of hospitals in India, only 30 of them are properly treated and 70 of them are improperly treated, and they continue having their veins for 5 years and 10 years, and they suffer from unimaginable pain. This is where the inevitability of Ayurveda, necessity of Ayurveda, non-replaceable ability of Ayurveda as a mainstream medicine for treating this particular conditions and alternative medicine is greatly emphasize, these are the cases where we can prove to government that we can give a significant amount of difference and significant amount of ability, a significant amount of cure to the patient, and therefore we can effectively, government should effectively use this as mainstream medicine for these diseases. That will help accelerate the curing, and that will give relief to n number of patients. So I hope sharing this case history really helps you. Thank you.